Well, new research into Alberta's doctor shortage reveals investment into primary care networks and not necessarily just money for doctors could be a key to solving the problem. Dr. Braden Manns led the study, joins us this morning. Dr. Manns, as always, we appreciate your time. And if we can just start with having you outline the doctor shortage for us and what some of the data says about where it's trending in the province.
Sure. I mean, we were interested in looking deeper at this because we know that about 20 to 25% of Canadians, pretty much the same in Alberta, don't have a family physician. And even for those who do have a family physician, if you're sick, it often takes 6 or more days. 50% of people, it takes 6 or more days to get in to see your family doctor. We also know that over the past 20 years, actually our population's gone up by 40% and the number of family docs has gone up by 40%. So it wasn't just a headcount problem here.
Yeah, so let's get into that the solution might not be to just hire more doctors.
So I don't actually think we can hire enough family physicians to provide access to primary care for all Albertans or all Canadians. If you look over the past 20 years, we've 3 times as many of our family physicians are from lower middle income countries. So we've been importing them. We haven't been producing our own. And the other solution that exists, we can talk a bit more about why we've got these problems, the backup in our family doctors' offices. But the other problem that exists is starting to use the skills of our other health professionals to a greater extent. So we've got primary care networks, which is, dietitians, nurses, diabetes nurse specialists, physiotherapists that can do some of the work that physicians can do in a team context, where we keep the docs focused on just what they do best. Diagnosis, seeing people with complex problems. And the other clinicians, if I have a back problem, a physiotherapist is probably has a better skill set to see that than I do, frankly. Same thing, if you've got diabetes, diabetes nurses are great at helping you manage your blood sugars. So if we use a team-based approach, docs will have more time to see patients with complex problems who are they're best suited to dealing with.
And so what is the structure now in terms of the funding, Dr. Manns? We do have these primary care networks. They exist across the province. And so when we're funding them, are we just not diverting the resources to those other types of caregivers?
Medicine and primary care as well is very doctor-centric. So 95% of funding for primary care goes to family physicians, and they're an important member of the team, but we spend a lot less on the allied health professionals. So primary care networks, a made in Alberta solution, they've been going for almost 20 years, but we invest a small amount. So for 10 family physicians, there's enough funding to provide about 4 allied health clinicians. So not nearly enough to support patients' needs.
Okay, and just about out of time, but are you hearing that the province has an understanding of these issues? Are you hopeful that we'll see some of this funding shift or the hiring shift?
I mean, even it's probably 4 years ago now, they started something called the Modernizing Alberta's Primary Care System. And out of that, they've implemented a few things. They created this primary care agency. Having a plan is really important, so that's great. Docs, to a certain extent, fall out of scope of that. And then last year, they implemented a non-fee-for-service payment model. When you're paid fee-for-service, it doesn't really help you work in a team. So now the question is whether docs will have enough trust to sign on to that new payment model, and whether they're willing to work in teams, and whether the province will invest more in teams.
Okay, and we'll see what kind of impact that might have. Dr. Braden Manns, very much appreciate your time this morning. That is Dr. Manns from the Cummings School of Medicine.
Thank you.
Thanks.